If you'll move to the next slide. The, the National Negro Health Week actually started in context of the larger public health movement in the United States. And it was centered around the mortality and morbidity rates for the Negro. It was centered around health promotion, disease prevention, and treatment in relationship to illnesses and disease. The major issues were sanitation, food preparation and storage, and access to healthcare. Sound familiar? The stumbling blocks in relation to it also included poverty, classism, racism, sexism, and some of the illnesses that were prevalent during that particular time were cholera, smallpox, yellow fever, typhoid fever, tuberculosis, syphilis, and gonorrhea. This happened in the context of the larger 19th century progressive movement, which is approximately 35 years after the end of slavery. And in that same period, we're talking about the 1996 Plessy versus Ferguson decision, the rewriting of state constitutions in the former Confederate states to include Jim Crow laws, and in the midst of the industrialization of the country and the increased European migration. The poor were routinely blamed for their poor health. Minorities, particularly Blacks, were for being inferior and more prone to disease. The medical profession itself was still in its infancy in regard to germ and bacterial theory and its spread and treatment from diseases that occurred because of. Issues included contamination, the existence of refrigeration and commercial refrigeration and ice only started in the 20th century. Methods of preserving food, drying, fermenting, canning, pasteurization, freezing, smoking, brining, all of those are things that we're dealing with in this period in relationship to it. There are three men that are probably the most prominent in relationship to the movement. Of course, Booker T. Washington, but Booker T. Washington's was more of the face of the National Negro Movement, though because of the Farmers Conference and his travels through Macon County, as he looked at recruiting students for the school and seeing the conditions in which people lived, health and sanitation were a primary emphasis of his. Next slide, please, Ben. Robert Moton faced some of the same issues, but with the Virginia Club or the association in Virginia, they approached it from a perspective of having a conference that first occurred in 1913 and again in 1914. In 1914, the primary speaker was Booker T. Washington, and Booker T. Washington, seeing what Dr. Moton and the Virginia Club had done, asked to use the premise that they had in relationship to doing it as a national movement. Next slide, please, ma'am. The third person is Dr. Monroe Nathan Work, someone a lot of people in Tuskegee are not aware of. He is the reason why we have an archives, and he was the developer of he was hired in 1908 to provide statistical information as it related to the Negro, Tuskegee students in particular, but also Negroes in the United States and the diaspora. And one of his emphasis was health. In 1903, he had done a large display in relationship to the issues of statistics as it related to the morbidity and mortality rates of African Americans during that particular, during the early 1900s, from the late 1800s into the 1900s. Next slide, please, ma'am. Which ended up in the Negro Yearbook, which was a publication that was started in 1912 and they existed through 1952. In that yearbook was information on health, as well as the all famous lynching reports. He issued 66 lynching reports during the time of his tenure at Tuskegee. He was the author of the lynching letter that came from the university. But in that Negro Yearbook, he divided things off into several categories. One, and the health categories included the names of Negro physicians, the name of facilities for Negroes, as well as health information as it related to diseases of the time, and particularly mortality and morbidity rates. Next slide, please, ma'am. This is one of the National Negro Health Week, launched in 1915 as a national movement. And though it was the original concept of Robert Moton, based on the statistical information of Monroe work. So without one, you don't get the other. And Moton realized, had no problem with Washington using his concept that they used in the Virginia at the Society of Virginia meeting, in terms of how they approached it, because he knew that Washington could get the national coverage for it. And this is a situation where my idea is fine, but if I can't get it to the target audience, it really doesn't matter. And Washington was the one that could do that. So it's a collaborative effort between the three. Next slide, please, ma'am. One of the individuals involved in it was Dr. Roscoe C. Brown. Now, some people are gonna see Roscoe C. Brown and think about Tuskegee Airmen. That's his son. This is the father of Roscoe C. Brown. And Roscoe Brown was a dentist from Washington, D.C. originally, who also trained as a health specialist and worked for the United States Public Health Department, and eventually was involved with the movement from its start, but also chronicled the movement in relationship. And this is an article that he wrote on it. The link on at the below will get you to that article in JSTOR from the Journal of Negro Health, where he outlines the work of Moton, Washington, and work as it relates to the beginning of the National Negro Health Week. Next slide, please, ma'am. These are just photographs in relationship to it. Each year they would pick a theme, and basically they would, and you can just flip through these kind of quickly because they're just photographs. I like photographs. They would pick a theme, and then the committees would, each community would work with projects through their churches, through their public health department or state health departments. There would be athletic contests. There would be lectures or sermons given in relationship to sanitation or health in general. There would be workshops in relationship to it, and like this one, in terms of instructing people how to do some health care, or when they shouldn't go to the doctor, or what things that they look. And these were each year, each community, though the dates usually was set around Booker T. Washington's birthday, which is April 6th, there was a lot of flexibility based on each community's needs as to when they could conduct their week. So sometimes it may be the week before his birthday, or it may be the week after his birthday, or whenever in that month it fit the community in relationship to dealing with it. And again, it steered clearly on sanitation, hygiene, preventive care. Back to the slide, the slide with Booker T on it, Ms. Frazier. We go back to that one.
Okay.
If you can see, this is an outline of exactly how some of those meetings were held: school events, mass meetings, clinics, cleanup. Cleanup was an important function in this, where the community would clean up, either sweeping, cleaning, painting, repairing, and issues. Clinics were held for children, adults, mass meetings in churches or YMCA, and school events like poster contests and that nature. Next slide, please, ma'am. Some of the sponsoring agencies for it, because I want you to understand, Tuskegee did not pay for this. Uh, Booker T did not reach in his back pocket and bring out the money to pay for the event. So some of the sponsoring agents, initially the Phelps Stokes Fund, provided the money to kick off the first campaign in 1915 under the auspices of the National Negro Business League. The United Public Health Service eventually took over the sponsoring of it because of the cost. Howard University or Howard College at the time, their medical school was involved in it to some degree. So there were a combination of Negro organizations as well as white organizations that were involved with the promotion and paying for the events that would occur. Next slide, please, ma'am. How did we get into this? It wasn't just Booker T. Next slide, please, ma'am. Tuskegee's first hospital was an infirmary. And on here you see a picture from the infirmary, then you see the first hospital, which was Pinehurst. I had the privilege of living in that as an apartment building. Tuskegee don't tear down nothing, they just convert it. And then the next is one of the earliest views of Johnny Andrew Hospital when it was built and its opening. Next slide, please, ma'am. Halle De La Tana was the first licensed physician in the state, Black physician and woman in the state of Alabama. And she also has established the nursing program, which had as a component of it public health. Next slide, please, ma'am. Dr. Kitty, who was the fourth medical director of Johnny Andrew and the first director to serve in as the director of Johnny Andrew Hospital. Next slide, please, ma'am. And with Dr. Kenny came the hospital, which was one of the few licensed hospitals to operate in the South for Negroes, the Johnny Andrew Memorial, the Clinical Society, which was also started in 1912, treated 400 patients. In its first operation, it initially was a clinic that brought physicians, Black and white, from all over the country to the university to treat patients that sometimes Dr. Kenny saved up based on whatever their condition was, so that these individuals who were experts in certain fields could relate to them. Black physicians at the time did not have hospital rights in some of the hospitals where some of the newer methods of treatment in terms of medicine was being done. So basically they'd come here, and for a week, Alabama's laws against Blacks and white mixing would be suspended, as these physicians who were pioneers in some of the new treatments that were happening in medicine would train Black physicians in these techniques, because they did not have that opportunity on a regular basis. Next slide, please, ma'am. It was Dr. Dibble's dream that turned to be a double-edged sword for Blacks to be involved in the new advances that were occurring in terms of medicine at the time. That's how we got into the syphilis study in some respects, because of the new research that was being done in medicine at the time, and because Black physicians did not have access to some of that method in white hospitals because they did not have voting privileges, that he worked to have us as involved in some of those studies as they were being done. And again, it turned out to be a double-edged sword when it came to the syphilis study. Next slide, please, ma'am. The Clinic Society met for over, they had its 50th anniversary in 1962. It dissolved in 1969. And one of the main issues for the Clinic Society over the years became public health, which were done under the name of physician Dr. C.B. Roman, in relationship to having papers presented, statistics presented, issues presented as to where we could become more involved in public health, should we become more involved in public health and how we could get involved in those public health those efforts. Next slide, please, ma'am. Another issue is the movable school. Dr. T.M. Campbell, in his book, The Movable Farm School Goes to the Negro Farmer, talks about the health issues that he came in contact with as he traveled to train farmers. One of the places he stopped to and had to stay because he had to usually live in with the farmers in the conditions whatever they lived in. And he talks about no soap, no toothpaste, someone offering him their toothbrush as when he stayed with them, being asked about questions as it related to preserving the foods that they were teaching the farmers to grow. You know, you can grow it, but then what do you do with it when it comes to terms of cooking it and preserving it? So a home demonstration agent was added to the movable school for that purpose. But he also got asked about health issues. And with that, he added a public health nurse, one of the first in the country, over Hester in 1920. And this was the position that in 1925, Miss Eunice Rivers occupied. Next slide, please. This again gives you an idea of the concentration in relationship to the issues that they were dealing with as and was a part of the program in relationship to National Negro Health Week. Clean milk. We don't think about the fact that there was no such thing as pasteurization. Infant care. We are dealing with people who are 40 years, 40, sometimes 40, 50 years outside of slavery, not having had the opportunity to properly care for their children during slavery and not knowing what to do out of slavery. As same thing in terms of care of sick, nutrition. If all you've been eating is fat back and beans, you may not know how to diversify your diet. Sanitation. I don't know if anybody on here is old enough to remember an outdoor toilet, but I do, and I would only go if my Uncle John took me. Uh, and he couldn't close the door, which presented a problem for him. So he would have to stand with his back to me while I'm in it. So sanitation, home improvement, keeping your house clean, screening, those things. So this is just an idea of some of the topics that they were dealing with in relationship to National Negro Health Week and public health in general. Next slide, please, ma'am. In Public Health Week ended in 1950. Was the feeling of the Public Health Service and in general that we were more of a meshed society and consequently no need for a specific week in relationship to the issues as they related to Blacks. However, Dr. John Ruffin, when he became the head of the Office of Minority Health, reinstituted it using the history of Negro Health Week as part of his rationale for instituting National Minority Health Month, which still exists today and is done in celebration of Negro National Negro Health Week. Next slide, please, ma'am. This is a sheet that gives you an idea. The OMH does have a website. It does have several divisions. Their main issues are related to the health of African Americans, Hispanic, Native Americans, Alaskan Natives, Asian Americans, and Pacific Islanders. And as I told Dr. Dunn, through my personal life, I got 2 half Hispanic step kids and 2 grandkids who are half Native American, and consequently, the month is very important to me as it relates to general health. And I want to give thanks to Mr. Chandler and Cheryl Ferguson. The records there are 14 boxes of material on National Negro Health Week in the archives. There are also several books. Mr. Chandler has a book. There is a book written by Susan Smith on Sick and Tired of Being Sick and Tired, which deals with the public health movement. Dr. Vanessa Gamble has done several scholarly articles in relationship to it. The problem with scholarly articles is that they tend not to make their way to the public that actually needs them. And that's pretty much it. If you have any questions, I'd be more than happy to answer.